Hi everyone, this is Dr. Janna with Intuition Health. So I am actually at a conference in Vancouver, Washington. I'm just kind of hiding out here while it's raining a little bit before I continue on my walk. My husband, Dr. Eric, had asked me to do some videos while I'm here, and since I didn't want to do the usual pretending to interview someone, I thought of something else that might be kind of fun. So when we're in the medical field, a lot of times you kind of gotta find ways to entertain yourself. Even if sometimes when people hear it who aren't the healthcare profession, think we might be a little jaded, but sometimes it's just what you got to do with the profession we do. So I thought it'd be fun to share some stories, because one of my favorite things is when patients come in with what they think something like medically and anatomically is called, and it's really not. Like rotary cup is always one. So I was seeing this patient, and she was in for chronic low back pain, and it's been going on for a long time. So I finally got x-rays, got an MRI, and she's just so distraught that she literally thought she was going to die, because she read her MRI report before anyone went over it with her. And I was I couldn't quite understand why she was so upset. I looked at the MRI report, it's pretty benign. She was in her 40s, otherwise healthy. I was I'm not really seeing, anything significant on here besides, kind of this wear and tear. Explain this all to her, and she's just tearful, and she's yeah, but she's no one's told me yet, but she's I have Schmals disease. And I was Schmals disease, what is Schmals disease? So I'm going back through her MRI report more in detail, and she had some Schmals nodes, and I was oh, you mean Schmals nodes? And she's yeah. I was oh, well, great news, you're not going to die of Schmals disease. And so we had this, so she wasn't very happy that I ended up kind of giggling, because I was what, Schmals disease? Because what came to my head, which now my whole family says, we're always you're killing me, Schmals. So that is our new saying at our house. And so it ended up being okay. I kind of explained to her what was going on. I explained to her what Schmals nodes were and why no one had told her specifically about those in the context of her low back pain. So that's one of my stories. And so as far as low back pain goes, just quick, a lot of times, we're told that there's nothing wrong. Or there's degenerative changes, and understanding that things like Schmals nodes and facet arthritis and degenerative disc disease, all of these things that are listed on an MRI report are signs of some kind of underlying functional unit problem. So we look at the low back, the spine, the neck, all as a functional unit, meaning the fascia, the nerves, the muscles, the ligaments, they're all attached, they're all functioning together. And so when we start trying to separate these out, that's sometimes why things aren't always as successful with back pain treatments. You got to treat it as a whole functional unit. And so Schmals nodes are a sign of kind of underlying degenerative processes starting. And so it's just this thing that tells us to keep looking. There's also no correlation between what someone's MRI shows and quote unquote severity of it in spines and what their pain level is, and that goes with shoulders, it goes with knees. So we've taught people to treat the image or treat the MRI. They come in saying, well, I have degenerative disc disease, I have a meniscus tear, I have a herniated disc. And what we're trying to get back to is, well, what brought you in? What is your problem? What are you trying to get back to? What can you not do? And at Intuition Health, that's really when we talk about finding a root cause. We're using someone's purpose, their goals of what can you not do and what do you want to get back to? And we use imaging as a tool to help guide us, but it's really based off of a history, a really good exam. Ultrasound exam adds a whole nother dynamic to how people move. So just understanding the complexity of pain and functional movement. And so if you have any other funny stories, please share below, and I'll certainly be sharing some more of my own. Thanks.